Hello, everyone, and welcome to another episode of The Doc Talk. I'm your host, Mian. So this podcast was conceived during the initial months of the pandemic when we were all in some type of either isolation or quarantine. And the value proposition of this podcast is to highlight professional achievements and to steer some innovative ideas for collaboration. And we sincerely hope that this platform will inspire professional growth and perhaps serve another venue for us to connect professionally and grow collectively. Well, that being said, today I am delighted to welcome our guest, who is Division Chief and Professor of Pediatric Otolaryngology and Vice Chair of Otolaryngology at UAMS, Director of Vascular Anomalies Center of Excellence. He's a clinician, a researcher, an entrepreneur, and definitely a great colleague, Dr. Gresham Richter. Welcome to the Doc Talk.
Hi, thank you for having me.
So Gresham, let's talk. So surgical specialties in general are obviously very procedure oriented, and training and post-training times are fairly tied up around the operating room. And you've successfully managed a clinical work and obviously a lot of research activities. So the question is, what is your clinical interest as a surgeon, and why do you think research is important for professional growth?
Thank you for the question, and thank you again for the opportunity to be here with you today. My specific clinical interests include airway surgery and vascular anomalies. I am a pediatric otolaryngologist by trade, which means I also operate within the head and neck to take out tumors and even do some complex ear surgery. I think it's important for us to have exposure to research because it keeps us on the front end of what's happening within the field. We're on the cutting edge. It gives us opportunity to learn from our colleagues and to apply those to better take care of our patients.
So in terms of professional growth and professional career, so almost every one of us can recall a significant event in our lives that leaves a sort of a lasting impact on professional growth and career trajectory. I mean, I can certainly attest to that, and to me, these are the events that inspire and sometimes even change the course. So would you like to share any such experience that has had an impact on your career and professional trajectory?
I think there are three events that really kind of impacted my life within the medical field.
Sure.
The first one was being engaged with an amazing mentor while I was at the University of Colorado, both before medical school and while I was in medical school. It was a guy by the name of Steve Abman. He was a pediatric pulmonologist that was just energetic, lively, brilliant, and just excited about all the research he was doing and how it applied to the clinical setting. That was my first step, and he really got me engaged in research.
Right.
And the second event was really during my time here at the University of Arkansas as a resident, and I was on the pediatric service doing pediatric ENT as a resident in training. Right. There was a moment there that I was able to do some research, and I started to see my publications coming out, and I was kind of saying, wow, I can actually make a difference and impact other people. And it kind of pushed me into the academic setting. I plan to do private practice, ear, nose, and throat, but when I was around the kids and I knew I thought academic was a way to go, it pushed me in the academic setting. And the last thing, and this is what I tell a lot of my students,
right.
There was one book that really influenced me and for my whole life, I think. And it was a book written by Stephen Covey called 7 Habits of Highly Effective People.
Yes.
And I read that during medical school and I think actually undergraduate. And I go back to it every now and then because I know it kind of helps me refocus on what my priorities are and helps me calculate how to prioritize my day with respect to my career, family, and of course research.
Yeah. So Stephen, he's a fabulous. I'm sure. I mean, I'm a big fan.
Yeah.
He's so when you mentioned the 7 Habits of Highly Effective People. So it's sort of one of his phrases that stuck with me is, and I quote, "Find your voice and inspire others to find theirs." And I think it has so much of wisdom and so much of depth that still inspires me to this day. And now I understand he's got another one, the eighth habit. That's also on a list that I probably should read.
He's like the Maslow, hierarchy of needs, of today, I think. He tells you kind of what are the things that are going to make you happy as a person. How do you address your life? And I think he does a great job. Yeah. And he starts with the book, right? He begins the book by saying, imagine someone's speaking about you at your eulogy, okay? And how would you want them to speak about you? And I think that's profound.
That's definitely a profound way to look at life. No question about it. So Gresham, you also direct a state-of-the-art multidisciplinary clinic at Children's Hospital, namely the Vascular Anomalies Center of Excellence, and which is truly outstanding, and I've seen it firsthand. I mean, it's got significant growth over the last maybe 5 to 7 years or so. So the question is, in healthcare, especially with diverse fields such as medicine and surgery, what is the added value for the patients who are managed in multidisciplinary programs?
Yeah, I appreciate you saying nice things about our program. I think we have done a nice job of really bringing a group of people that are just brilliant together into the same room to talk about patients. And it brings me back to the reality is no medical condition is simple.
So true.
And every medical condition touches upon multiple people within the medical field. Whether it's as simple as putting an ear tube, it required a pediatrician to see that person first multiple times to diagnose ear infections, ultimately to get reviewed by an anesthesiologist, make sure it's okay to undergo a procedure to get ear tubes, while all the nursing support that is happening along the way. I mean, think about that, every step of the way. So I feel multidisciplinary is what we do. When we create a center around it, what we're really doing is putting everybody in the same room. And it's much like the Mayo model of medicine, right? Let them see everybody the same day who have different ideas, different perspectives that will add to the whole good of the patient. And it provides a collaborative atmosphere. It encourages innovation. It takes us to the next level, really, of how we can manage these patients. First, we were operating on most of these kids in vascular anomalies and doing lasers, and now we're at an era where we're applying medicine, and that's the direction we were trying to take. But it wasn't one person going to do that. It required a team, as Hillary said, it takes a village, right?
It sure does.
So it really does. And we are our small village, as long as you work well together, can make a huge difference on kids.
So Gresham, let's just talk about a little bit more detail about this model. So what are your thoughts? How does it work?
We involve more than just this clinical disciplines too. We use the research side. Our research side has allowed us to get to a level of identifying the molecular factors that are involved in vascular anomalies to help us target how to treat them without removing them, to use medicine and pharmacotherapy to target these lesions specifically. But it didn't require just the researchers. You have to have someone who can apply it. Your colleagues, Dr. Mack and Dr. Crary, who are engaged in the vascular anomalies group, they are now the ones who have the medicines available to shrink these lesions down, compared to us just trying to ablate them or remove them. So it's taken a while, but it required our research here that subsequently translated into colleagues that could actually use that research to apply medicine to help take care of the patient.
I could speak firsthand. I mean, my son has been treated in your center, and we feel so blessed to be here and to be treated by the team. I just cannot say enough of great things. How grateful we are.
Well, that's our honor.
There. So for our colleagues who may wish to explore these ideas of cross-specialty, I think your point is well taken. This is where the greatest value for the patients are. So for colleagues who wish to explore cross-specialty collaborations, and if someone had a novel idea to pilot let's say a multidisciplinary clinic for that matter, what would you advise them? What are the top 3 challenges that they need to be aware of, and how should they address those challenges?
Fortunately, we've been able to start several multidisciplinary clinics in ENT. And the way we start them, and this came from trial and error first, is we realized that in order to get all the specialties together, we had to get them to think globally about the patient. Right. And in order to do that, each one of the specialties had to kind of give a sense of what their knowledge base is relative to the disease,
right,
and present it to each of the other colleagues. And we would do that for multiple meetings. So I would recommend is that you have multiple meetings with the people that are going to be involved to align their thought process, to say, yeah, I agree with that, but maybe this is an alternative. And then, so when you finally put the patients in the clinic, then you are in alignment in how you think about how you're going to manage them. The best way to run a clinic, I think, in multidisciplinary is to have a pre-evaluation through their imaging, looking at their chart, talking about them, and then you bring the team to go see the patient afterwards.
Right.
And then you have already really essentially created your plan. It may change a little bit when you see the patient, but your plan is in place and everybody's aligned before you see them. But it takes many meetings before that in order to make sure that people are thinking the same way. We've realized that right off the bat with a couple of our clinics.
And obviously, the preparation and getting all the patient records and everything and just going over the plan obviously helps a great deal.
Yeah, and really you have to have a dedicated specialty nurse or a coordinator to do that. Without that, it will never work. I would also add that once you get it going, it's not going to happen in a vacuum, right? You've got to get the word out, and you need to get your marketing team with your hospital involved. You got to get public relations. You've got to work with your physician liaisons that are working with the community on how to get the information that, hey, we're starting a new clinic. It's multidisciplinary. It's Mayo model style. Let's get kids in so we can take care of them all at once.
Right. So then it's primarily competence, resources, and then marketing to get the word out.
That's right. Thank you for simplifying. And one of the things that happens, though, physicians have to sacrifice in order to do that, because in today's day and age, we generate RVUs which is important, but in order to see a complex patient, you're unable to see them as efficiently as you can see multiple.
Sure.
And so when you're in a multidisciplinary clinic, you have to have a commitment from the people who are saying, you know what, this is important to me, and I don't care how it impacts the RVUs that I'm generating. It's really more important that we take care of these patients in a global fashion.
Right. And this now that you mentioned about the RVUs and that aspect of medicine, so that sort of leads into the next, very nicely leads into the next topic. So shifting gears slightly, so the business side of medicine. So during residency and fellowship, we're all exclusively focused, and rightfully so, only on the clinical side of medicine. And then obviously when we enter practical life, we find out that there are critical aspects of medicine which are not adequately trained. And one such aspect happens to be the business of medicine. So do you see any value in it, that this be taught? And if there should be any attempts to put some emphasis during, for example, residency training?
Yeah, absolutely. And I would even go sooner than that. I would recommend that fundamental knowledge about business and medicine begins as a medical student.
Right.
As a matter of fact, one of my early mentors helped me design a business and medicine series when I was a med student. And really what got me into ENT, it was another influence in my life that kind of encouraged me to go into ENT, because he was in the business world, but also an otolaryngologist. In order to be successful in whatever you do, you have to understand the pressures that are influencing your day-to-day activities. And as you and I both know, we have seen that happen and become more engaged in the academic world, than it used to be when it comes to taking care of patients. Naturally, it includes the business aspect that drives how our behavior is to some degree. So if you understand it, you can work with it, or you can know how to kind of work around it or within the confines of what the business model is trying to direct you to do as a physician.
And this so pretty much on the same topic. It's another segue to the second topic that certainly excites me, and that is medical entrepreneurship. So, which is sometimes overlooked, I think, but I think it offers an important venue for professional growth. So what has your journey been like in this domain, and what was the starting point, and how do you think it contributes towards professional growth?
I'm excited about that too. As you know, I think we all have that within us, that we hope that someday that we can make a difference, right?
Sure.
And really one of the avenues to do that as a physician is because you have a unique set of knowledge. And within your field, especially if you subspecialize,
right,
you have the opportunity to pave the way for new ideas, new companies, new products. By being in that position, you could potentially utilize that to take care of patients. The way I think about it is anytime I'm in a setting where I'm processing, hey, this is not done right. I mean, there should be something better than this. There's got to be a better way to perform this. Once you have that thought, the next natural step should not be, this is terrible, I'm going to try and get around it. The next natural step should be, how do I fix it?
Right.
And that's where innovation comes from. That's where the physician entrepreneur emerges, okay? And it's exactly, what we were able to do with multiple venues within my sphere with surgeries, and have been able to shoot off a couple companies as a result of that.
Well, this is definitely inspiring, and the more I have explored this domain, the more exciting it sounds. And looking around, when we read about all the stories of physician entrepreneurs who have done remarkably well, and not only in clinical practice, but they have brought in products and launched startups as a side gig, and they've been so successful and brought so much value to the patient care. This is absolutely amazing. And
yeah, I think that's the point at which you codify your professional growth.
Right.
Is where you've taken something that you know is important to the well-being of your patients, and you've been able to bring it to market.
Right.
You've been really able to make it happen for them. And if you do it for the right reasons, it's wonderful. It's exciting.
It sure is. So, towards the end, so as much as I don't want to talk about COVID, let's still talk about it. So now that we're almost 8 to 9 months into it, and we're still faced with probably the biggest challenge of our times, and we all are still struggling to an extent to find in a way a new norm. So your professional area is focused around the airway, and obviously COVID is a aerosolized virus, and it has impacted otolaryngology to a great extent. So do you see any silver lining within this context?
Yes, I do. ENT was impacted pretty hard right off the bat. Many of the physicians that were first exposed to the virus, some of them which died in China, were otolaryngologists because of the high viral load at which they were exposed to early on. And so it changed our field very quickly, and we had to reevaluate what it means to do a scope, reevaluate what it means to clean an ear, reevaluate and to what degree can we protect ourselves. So we pulled back our practice at first, which impacted patients, of course, and we have slowly reintroduced the way we do things, kind of reinventing the wheel, while creating a high degree of safety precautions around it for the physicians, for the people around us, right, nurses, the operating room personnel. And, however, the silver lining is not only did we have to, it's always good to have change. That's one of the silver linings. Sure. It's always good to reevaluate how you do things, right, within your field. The second silver lining is that kids are healthier. Everybody's wearing masks. Kids wash or sanitize all day long at school. For those that are going to school, our numbers of otolaryngology conditions has gone down to probably 60 to 70% across the nation of what it used to be. So our volumes have reduced, which means kids are healthier and they're getting less procedures, less operations. So that's the silver lining. We may not, it's good for the health of the patients. Maybe not for, ENT as a field so much, but it's great for the patients themselves.
It sure is, no doubt. Hand washing, masking, and distance has helped us keep safe. And we all have kids. And they've gone to school, and so far things have been holding true.
I certainly hope it stays that way. We've seen that in other countries where they now wear masks routinely, and I hope we find ourselves doing that when COVID subsides or when we tackle it, that we find ourselves maintaining those behaviors and habits.
And those are certainly healthy behaviors and healthy habits, no question about it. So Dr. Richter, thank you so much for your time this afternoon. I know you had to come from the OR, so we really appreciate it. We want to thank our listeners for tuning in. I hope you enjoyed this conversation as much as I did. And if so, may I ask you to consider sharing this link with your colleagues and friends on social media in this age of social distancing, as we stay 6 feet apart with our masks on. Our aim is to present at least 2 Doc Talk podcasts each month, and you can definitely find us on Apple Podcasts, Spotify, or wherever you get your podcasts from. Until we meet again next time, stay well, stay safe.